Hi there, thank you for joining me here in my office. My name is Dr. Michael, and before we get too far into this video, I just first want to say thank you, like a genuine thank you, because if you're here watching this video, that means you got some stuff going on. That means you're probably in pain. That means you may also have some other health issues and conditions going on. And in all likelihood, you may have seen multiple other chiropractors. You might have seen medical doctor, you might have seen some specialists, maybe you tried some medications, some supplements, maybe some surgeries. But if you're here, that means you still got some things going on. So first and foremost, I want to give you a genuine thank you for putting your trust in me. So now this video should really only ideally take maybe 5 or 10 minutes. I want to give you a nice quick orientation of what this whole process is going to look like, you know, what I do, what I don't do, what separates me from literally 99% of the chiropractors out there. And we're gonna get into that. So without further ado, let's do it. So first, let me briefly give you a story of how I got into chiropractic, because this is gonna give you a quick window into how I think and what I do everything, because really this story helps to encapsulate a lot of what I really internally, the way I view and the way I heal. So my grandfather, he was born in around the Great Depression type of era, and so when he was growing up, he had two options: become a teacher, become a plumber. Plumbers made more money, so he became a plumber. And so in those conditions, after years and years of doing that, he was exposed to, we believe, a lot of asbestos. So he ended up getting cancer, but it first showed up in his bladder. And so he went to the medical doctor because he noticed some blood in his urine. And the doctor said, no problem, we'll zap it and it'll go away. If you ever notice any blood, come back. Otherwise, we'll just check up on you every 6 months or so. And so he did that over a course of, imagine, a couple of years. And, sometimes it would come back, they'd zap it, he'd go home, he'd be fine, he'd come back, they'd zap it, etc. Well, one time he showed back up and he had stage 4 cancer. So in the way only a little version of me could have said, I looked at my mom and dad, I was like, Mom, I thought they were zapping it. What was going on? So the cancer spread from his bladder to his lungs, to his bones, to all over his body. So we know how that story ends. So what I pulled away from that was, they had to wait for it to get so bad before they could treat it. And to me, that didn't make sense. I said, well, why didn't you treat it before it became officially a big problem? And so that question led me into getting into chiropractic, because chiropractic is one of those few professions where we don't need you to wait till you have a massive problem and then we can treat you. I want to treat you before you have these things. Now, of course, we can help you with a lot of things after you have your diagnosis or whatever's going on, but we can help you before. And so that's what I want to do. I want you to get healthy, stay healthy, and then give you the tools to stay healthy on your own, so you don't need me, or need me as little as possible. So with that story of my grandfather in mind, chiropractic allowed me a way where I could help people without needing the drugs, without needing the surgery. Because the way chiropractic is performed is, we understand the brain runs the body. Everybody agrees on that. But what we do know is, when the brain wants to talk to the body, it has to send messages down the spinal cord, out the nerves, and then into wherever it's going to go, into any of the muscles, tissue, organ, glands. Everything in your body is controlled through the nerves. So I had Sharon, a patient of mine, coming in. She initially came in with numbness and pain going down her arm. And so, she tried the prescription drugs and the medication, and she went to the medical doctor and the specialist. I think she even tried a couple minor surgeries. She wasn't getting any relief. And after 6 or 7 visits, completely back to normal. No pain and no numbness, nothing. She was perfect. And still to this day, she's doing great. And so I use that story to say is, drugs and surgery sometimes are great options, but a lot of the time we don't need that. That's not the only way we can get the body to heal. And so you're going to discover that here. So chances a lot of you have been to the chiropractor before. And as we briefly just mentioned before, the body is controlled by the brain. the brain must be able to communicate with the body. So as the brain sends those messages down the spinal cord, out the nerve, and then going to whatever organ, muscle, tissue, cell, wherever it needs to go. And now again, let's say the lungs need some help, right? So the brain's gonna say, hey lungs, how you doing? Down the spinal cord to the nerve. The lungs are gonna say, hey, I need some help, whatever the help might be. It's gonna send that message back through the nerve, up the spinal cord to the brain, and now the brain can enlist all the other organ systems and all the other body parts to help it in whatever way it needs the help. So my job as a chiropractor, of course, is to make sure the spine is aligned straight, because when it gets crooked, that can put pressure and constrict the nerve directly or indirectly. And now that's going to interfere with the body's ability to get the lungs to heal properly, or any other part of the body. But in addition to making sure that the spine is aligned, there's no pressure on the nerve, there's no pain locally at that point, but also I know that the body's broken up into 6 main systems. These 6 systems are controlled by 6 different parts of your brain. So now real briefly here, we can see one of the systems is the glandular system. So one part of your brain controls all the glands and hormones in your body. This can affect sleep, mood, immune system, skin, hair, anxiety, depression type of symptoms, things like that. Next, we have the eliminative system. Now this is going to be your sinuses, your mouth, throat, lungs, skin, kidneys, bowel, bladder, anything that gets stuff out of the body. It's almost like the detox zone. So people with, sinus congestion or allergies or asthma, bronchitis, any skin issues like eczema, psoriasis, maybe constipation, maybe chronic diarrhea, anything going on down here, okay? And then next is going to be the nervous system. Really, really important one. This is going to be really great, anything neurological. Currently we're seeing some dementia patients getting some great results, actually reversing a lot of those symptoms. But not just that, it's also things like concussions, any numbness and tingling down the arm, maybe painful menstruation for women, any reproductive or fertility issues for both sexes. So next, we're going to go to zone number 4, system number 4, and that's going to be the digestive system. So this is, like it sounds, anything with digestion. So if there's any foods that you currently don't tolerate well, like gluten, like dairy, this month we've helped at least 7 people who previously couldn't eat dairy or gluten. Now they can. So just know, once your nervous system and your digestive system is working properly, you can do a basic thing like that. Next, we have the muscle system over here. Really cool zone. Anytime we have tight muscles, aches and pains, this deals with all the muscles, tendons, ligaments, joints, and bone. Really big, really big. Really big with balance and vertigo. And then lastly, it's going to be the circulatory system. So this helps a lot with anybody with blood pressure issues, cold hands and feet, headaches, swelling. So this is any of the circulatory systems in the body. So what we understand is that when we can get the brain centers balanced, when we can make sure the spine is aligned straight, taking the pressure off the nerve, now the brain can actually monitor the body and regulate it, getting whatever it needs to this spot to get it to heal. So now that I explained that, I can tell you a real cool story. So I had this young woman, she was about 40 years old, and so she told me, she said, every single day for the last 15 years, yes, you heard that correctly, 15 years, she would throw up after every single dinner, and she would only go to the bathroom, number 2, once every 4 days. That's a problem. She had been to multiple chiropractors. She tried the medical doctors, she tried the drugs, the surgery, everything. She comes to my office, and I'm happy to say, in 3 visits, we got her completely regular, going to the bathroom every single day, and she no longer threw up. That's pretty cool. So now we have to ask, like, what am I doing different than what other chiropractors were doing? Well, the difference is I'm paying attention to the brain, because this technique is a spinal cord stimulation technique designed to help reset those parts of the brain that aren't working properly so the brain can do its job and get the whole body to function and heal naturally.